Let's begin a clinical vignette. A 30-year-old male John comes for doctor visit due to progressive difficulty in swallowing, initially to solid and later to liquids, associated with significant weight loss in previous 6 months. Barium study revealed narrowing of esophagus with irregular border that protrude into the lumen. What is most likely diagnosis of this patient? Now I'm going to highlight some important stuff related to the esophageal carcinoma. So the presentation of the esophageal carcinoma, the patient present with the progressive dysphagia that start with solid and later to the liquid. Esophageal carcinoma associated with weight loss, odynophagia, GERD, gastroesophageal reflux disease, and GI bleeding. Esophageal carcinoma mainly divided into the two types, adenocarcinoma and squamous cell carcinoma. So the most in USA, adenocarcinoma is most common in USA, while squamous cell carcinoma most common worldwide. So adenocarcinoma most common location is a lower third of the esophagus, while the squamous cell carcinoma, upper one third and middle portion is a common location for the squamous cell carcinoma. So the main risk factor of the squamous cell carcinoma, alcohol, hot liquid intakes, caustic stricture, smoking, and eclasia, while the adenocarcinoma risk factor are chronic GERD patient, Barrett esophagus, and obesity. So what happened? This chronic GERD induced Barrett esophagus in the lower one third of the esophagus. So basically, it is basically the Barrett esophagus is a metaplasia. So what happened in this metaplasia? So non-keratinized squamous epithelium, squamous epithelium change into intestinal type, intestinal type epithelium at the lower portion of the esophagus. So diagnosis made on the different tests. So the barium study is the first initial test. So the first initial, it shows narrowing of the esophagus, narrowing plus irregular border that protrude into the lumen. Into the lumen. Next is the endoscopy and biopsy that make diagnosis. It make diagnosis. So diagnosis based on the biopsy and endoscopy. Next, CT and ultrasound helpful for the staging of the esophageal carcinoma. So the esophageal carcinoma has a poor prognosis. Why it has a poor prognosis? Because it lacks serosa. So its course is aggressive, lacks serosa, and it has a poor prognosis, and the patient present at the advanced stage. Presentation of the patient at advanced stage of the disease. Advanced stage of the disease. Next is the treatment. The treatment, chemoradiation and surgical resection is the first line treatment. So the first line treatment. Resection is also indicated in high-grade Barrett dysplasia because it convert into the adenocarcinoma. The right option of this clinical vignette is the esophageal carcinoma, esophageal cancer.